Hello, 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 and welcome to the show. Happy birthday to the National Health Service. It is, of course, 75 years old. It was founded back in 1948, the post-war Labour government of Clement Attlee, the most transformative government in British history. But the National Health Service, on its 75th birthday, is in a state of crisis. Some fear terminal crisis. I'm now going to bring in the brilliant Andrew Meyerson, who's an A&E doctor in East London. Thanks for joining us, obviously, as ever.
Thanks so much for having me.
No, it's big honor to have your experience.
I came here about 8 years ago to study medicine, and I stayed to work in the NHS because I love it and I value it to an extent that a lot of people just don't understand. But when you grow up in the States, I grew up in a healthcare family. My father was a doctor. My mother was a speech pathologist. My brother, an EMT. My sister ran a palliative care department. My one aunt was a matron. Another uncle ran a radiology department, and another uncle was a burns nurse. So I have been around the delivery of healthcare and for quite a while throughout my entire life. Fortunate to have good health insurance myself, but I've seen the and friends just devastated financially because of American healthcare bills. We have 500,000 Americans declaring bankruptcy every year because of these terrible medical bills, and we have about 30 million people who have no health insurance at all, and another 50 million who have a catastrophic insurance, or that we say that they're underinsured. That in the event that they need health care, they're not able to get it to an adequate degree. A family member being charged $15,000 to be taken to hospital in an ambulance, or people that when they're in a catastrophic accident, telling people not to call 911 because they just can't afford to go to the hospital. That is in the wealthiest country on the planet. It is barbaric, and it is among the wealthiest countries in the world. We have the U.S. has the worst ranked healthcare system. We waste enormous amounts of money. We spend double the amount per person that the NHS does. And 75 years ago, after World War II, you guys made the brilliant, revolutionary decision, as you mentioned earlier in the program, to implement a healthcare system like this that was free at the point of use, that guaranteed high quality care, whether you were a prince or a pauper, and it transformed the health and wealth of this country for generations to come. And the proof is just, look, 10 years ago, the NHS was ranked the #1 healthcare system on the planet. The Commonwealth Fund said that you guys were the absolute best model of healthcare delivery anywhere in the world, beating every other, hybrid model from Europe, and certainly the privatized model from the United States. And so, when I came here, when I came to the UK from the horrors of American healthcare, I feel like I came to the promised land of healthcare. But then, as I've been training over the last 8 years, and I became a doctor in 2019, right before the pandemic, and been working in A&E pretty much since, I have seen a formerly great health system be driven into the ground by policy decisions from successive conservative governments who have no interest in improving the healthcare of patients. They have completely run down the system, underfunded it, understaffed it, undermined it, and to the point now where 10 years ago we were the best healthcare system on the planet here in the UK, and now we're performing among the worst in Europe.
It's quite striking that Sajid Javid, who used to be the health secretary under the Conservatives, was saying that the NHS in its current form isn't working, and politicians from both sides think that. And it just came across to me, we're talking about these testos on the Jeremy Vine show, this cropped up, kind of the cheek of being the Conservatives in power for 13 years, underfunding and under-resourcing and fragmenting the NHS, and then going, guys, this model's not working anymore, is it?
Yeah, what happened? Shocking. Yeah.
I mean, what's your thought? What's your just in terms of that? I mean, is that kind of the real sense there that you end up with a Tory government, they wreck the NHS, and then they use that as evidence the NHS model doesn't work, and therefore we have to start privatizing and charging people?
Yeah, these are people with no credibility at all. They inherited the #1 healthcare system on the planet, and then look what they've done to it. We have 7.4 million people waiting on the longest waiting list in NHS history. Patients are waiting longer to see their GP, to be seen in A&E, to get their cancer care, to get outpatient care than ever before. And to hear Sajid Javid make comments like that, and to hear that Steve Barclay saying that we need to work harder in order to deserve a pay rise, or that that all of the problems are just suddenly just magically appeared, or they blame the pandemic. Our waiting lists were nearing 5 million before the pandemic even started. That is their excuse that they love to talk about. But they were, for the last 10 years, they have done enormous damage to the system. That rises to the level of criminal grade neglect in my book. Because if you have the most efficient healthcare system on the planet 10 years ago, and you underfund it by 40 billion pounds a year, that's 400 billion over the last decade, compared to what Germany and France have spent in their health systems. And if you remove an enormous number of hospitals, of A&E departments, if you allow the staff crisis to grow, well beyond, it was something like 130,000 people now, and even more in social care, and then make promises that we are going to fix social care, that they're going to solve this problem of bed blocking, they call it, of patients in the hospital unable to be discharged into social care. They've made promises year on year, every single year, and we haven't hit A&E targets, we haven't hit cancer targets, since 2015. They have overseen the greatest assault on the NHS in its 75-year history, and they have absolutely no credibility left. And and anybody who cares about the NHS, who values it, shouldn't believe a word that they say. I mean, you see the proliferation of private healthcare right now in this country, and this is all by design. Run down the system, underfund it, under-resource it, and get the waiting lists up to 7.4 million people, get satisfaction lower, and then say, and it's holding the public hostage in this way, saying that if you want care, then go and register with a private GP. It won't cost that much, but of course it will. It absolutely will. And, that's why you're going to see the introduction of medical debt in this country. And, emblematic of all of this, the Cleveland Clinic, a major, a huge hospital in Cleveland, United States, opened up a brand new hospital right next to Buckingham Palace. That, that says everything we need to know about, the links between the wealthy in this country and private healthcare. And that they have that, while the rest of us suffer on the longest waiting list in the NHS history. I think that's just plain wrong, and that's why we feel the need to speak up about it, because patients deserve a hell of a lot better than what they're getting right now.